In March, Minneapolis hired Damone Chaplin as the city's new health commissioner, the first in 20 years. Sharon Yu got to sit down with him to talk about his priorities and the perspective he brings to the job as an outsider who recently relocated here from Massachusetts.
For the past 90 days, Commissioner Damone Chaplin has been absorbing Minneapolis.
Learning how business gets done, learning what people value and what some of the core issues are here, and getting to know people.
So far, what have you learned? What are the core values of the people that you've spoken to?
Everyone is excited about the future, and I'm very excited about helping them reach their goals and get to a place where we can kind of enjoy Minneapolis the way that we like to.
Chaplin brings a list of issues he's passionate about.
Right now, what we're focused on is substance abuse, homeless encampments, and racial equity and health equity within the city. A majority of the folks that are experiencing homelessness here, many of them are, either have mental health issues or substance abuse issues. Not all of them, but a good number of them may. For us, our job is to try and help provide a public health approach to support for them. That may include sanitation and hygiene support, may include community outreach and education.
Is adding more shelter a priority as well for the city? Because that was something that we ran into this past winter.
Yeah, the city has taken a housing first approach. The county has taken a housing first approach to homelessness, which means that you really don't get a chance to understand a person's underlying issues until they have housing. And so we try to provide housing at a level, and then we try to wrap all the other services that are needed around the person or the individuals.
And with Minneapolis having declared racism as a public health emergency in 2020, Chaplin says work will involve diving deeper.
Really wanting to set the health department up to be able to respond to racial and health equity issues, being able to close the gap on health and racial disparities within the city. Those were all, and still are, goals of mine. That involves engaging with the community, engaging with staff. It involves understanding the root cause of why some of this is happening, and then getting the root cause and developing program services and policies that's going to help mitigate that. We are committed to dismantling racism as a public health crisis. We are committed to making change, and we're committed to moving the needle forward.
Now, in terms of having enough funding to achieve all of these goals, the commissioner told Sharon that with a lot of the pandemic-era funding running out, they are always looking for ways to raise more money, including through grant programs.